Here to tell us how to identify a feeding disorder is Tim Hanafi, a behavioral therapist at the Child Learning and Enrichment Medical Center. Hello Tim, welcome to the show. Right, now parents all around the world struggle to make sure that their kids, especially during infancy and early childhood, get the right amount of nutrition. Now we've heard of eating disorder, but what exactly is feeding disorder? Is it the same?
No, with a feeding disorder, one of the warning signs definitely would be that the child is not eating the right quantity of food, a lower amount. And then the second thing would be that their repertoire of foods that they do eat is not large enough. Like I've had children that I work with that will only drink milk out of a bottle.
What age are you talking about?
3 years old.
Really?
Yeah. No solid foods, not even semi-solid foods. Just milk.
And from what age to what age are they most likely to develop this issue?
This issue, especially when it comes to children that have autistic spectrum disorders, the issue can show up right when the child should be going off of milk. And if it's not treated then, I've worked with children as old as 10 years old, where we still are trying to increase from 3 or 4 foods to a larger number. And when I say 3 or 4 foods, I don't mean like eats chicken, beef, and vegetables. I'm talking about eats like chicken nuggets, tomato, if they're cut a certain way, and like will drink juice if it's in a certain cup, things like that.
So if a child gets to that stage, and this is what we're sort of addressing here, a feeding disorder, where a child can only put a certain food stuff into its mouth, or a food that's cut in a certain way, prepared in a certain way. Is that a direct reaction to the feeding process a little earlier on in their life, or can it be rectified? Can it be something that comes into their life later on? Yeah,
it can be fixed, but like the later you leave it, the harder it's going to be.
Right.
It's a big part of the treatment has to do with desensitization.
Okay.
So similar to the way like the certain foods have an acquired taste, or certain drinks have an acquired taste. But with repeated exposure, what happens? You start to actually enjoy that food or that drink. So you just, with repeated exposure and slowly increasing the amount, the body can learn to accept that food or drink. Yeah.
It's a strange one. I don't get it from a parent's point of view. I know that, as we mentioned, that children can be fussy. But if your children's just eating chicken nuggets, your children's just on peanut butter and fries or something like that, as a parent, surely you'd notice. Wouldn't you say something's wrong here? Or a parent's forgiving?
Well, I think in certain cases, they wouldn't know where to go.
Right.
Especially somewhere like here in Dubai.
Yeah.
Yeah.
Now, how can you tell if the child is just being fussy? Because I know of a lot of mothers who complain that their child doesn't eat properly. But but later on, they just become fine and they start graduating into other kinds of foods. So when do you know if they're actually being fussy or if they actually have a feeding disorder?
Well, as someone with a behavioral background, we don't usually use words like fussy, but I've also seen parents that will, for example, try and get their child to eat celery. And it's not like everyone in the world needs to eat celery. So it's like, as long as, what does it come down to? As long as you're getting food from all of the major food groups with some type of variety, then that should be okay. And if you're not, then it's not okay.
If this isn't addressed, if this issue is not addressed, talk to me about the consequences. I mean, other than the child not looking very well, looking a little pale maybe, what sort of health consequences is there?
Well, so aside from the kind of nutritional deficiency consequences, there's social consequences. Like, say, for example, your child's going to a birthday party, and all there is cake and hot dogs and hamburgers. Well, if your child doesn't eat those foods, and all the other 11-year-olds are, at that age, your child's going to start to stand out. And it's going to be like, you know, what's wrong with Jerry? How come he's not eating with us? So it can isolate you from social groups. And that, like, when children are not drinking milk, like when all they're doing is drinking milk out of a bottle till the age of 3 or 4, their teeth can start to get deformed. And,
Say a child is diagnosed with a feeding disorder, what can be done to cure it? I mean, it is curable, right?
Yeah, but it takes a lot of work. Like, one of the things I do is I'll train parents how to introduce new foods. So then they can introduce those foods at meal times every day while I'm not there. And it increases that rate of exposure. And yeah, over time you can get rid of those sensitivities.
I read also as well the issue with oral sensitivity, and this can actually sort of result in children choking on certain foods. Is that an issue as well?
Yeah, but the treatment for that is not behavioral.
Right.
So it's the treatment will be something that an occupational therapist would be doing. Because yeah, some children just can't even swallow.
Yeah.
So there's no behavioral problem there. They just don't know how to do it.
And that comes from the foods that they've been eating from a young age, or that is a physical problem?
No, it can be related to autistic spectrum disorder, where they just lack that oral motor control, the motions that are required to swallow food.
Okay.
Yeah.
What advice would you like to give to the parents out there who maybe have not suspected such a disorder in their child, but there is a possibility?
Well, they could come see us, but I think one of the major mistakes that parents make is they start to worry so much, and they start trying to force the children to eat, and then things just get out of control. The more that you can kind of sit back and not let your child know that it bothers you so much, but get the treatment, start getting your child the treatment that they need.